It is my great pleasure in speaking to you today, and I will be presenting results of an evaluation of the so-called postgraduate specialty training, which we also sometimes call PUST, of family medicine doctors in Tajikistan. And it's actually a joint presentation. Halfway through, I will hand over to my colleague Yari Kempers, who will then give you a little bit of insights into an impact and investment case. The PUST was actually implemented as part of the larger project, which is the Medical Education Reform Project. And Helen has already touched upon this project. It is a project which is financed and mandated by SDC, and which is implemented by Swiss DPH currently in its third phase, and at the very end of it, actually. Medical education reform is a priority in the National Health Strategy of Tajikistan, the current one, and particularly primary health care. Within the MAP project, and the MAP supported the Postgraduate Medical Institute to actually implement a 2-year post-university specialty training for medical family medicine doctors. And it had a particular strong emphasis on practical, but also partly theoretical knowledge increase. At the same time, in Tajikistan, there is also a program for the specialization of family medicine doctors, which is a 1-year internship, and it's also still running. However, it's a rather unstructured work experience. In order to evaluate the PUST program, we used 2 different methods, and Zika has already explained what an OSCE is, the Objective Structured Clinical Examination. And by using the OSCE, we were particularly looking at clinical skills, attitudes, and behavior. We established 5 different stations where we asked, for example, for history taking, we observed examinations, etc. And for doing so, we trained 4 patient simulators, and we also trained 10 examiners. In addition, we used a so-called MCQ, a multiple choice questionnaire, and here we were hoping to find out more about the theoretical clinical knowledge of the PUST participants. We used a 60-item MCQ, and we focused on 20 tracer diseases which were of particular interest and which are very important for family medicine doctors in the Tajik context. And we trained 3 invigilators who were overlooking the exam. The data was analyzed. We were using SPSS and statistical tests, as you can see below. Who did we actually include? And we included 3 different groups. One of them were the graduated medical students who actually newly entered the PUST program, the 2-year program, the ones in green. And around 20 participated for both of the tests. We also included intern family medicine doctors, who are the ones newly graduated family medicine doctors who have completed the 1-year internship. And of course, we have included the PUST family medicine doctors, who were the newly graduated family medicine doctors who completed the 2-year PUST course. What are the results? When looking at the OSCE, and here this is really the results in a nutshell, we could probably talk about this for hours, so it's really very reduced. We could very clearly see that the PUST family medicine doctors who completed the 2 years of training performed best in the OSCEs. And that was followed by the PUSTs who entered in the 1st-year program, and then only after the intern family medicine doctors, they were actually performing poorest of all. We could also see a statistical significant difference between the performance of the PUST family medicine doctors and both interns and 1st years, which you can actually also see on the right. And PUST family medicine doctors achieved higher test scores on average. And you can see here, they actually achieved 60% of the total OSCE scores, whereas the PUST 1st years achieved 47%, and the intern family medicine doctors achieved only 45%. So you can see a difference here very clearly. Interestingly, we were also comparing performance of female and male participants, And we could see a statistically significant gender difference when it comes to female post-family medicine doctors. They were performing better in history taking compared to their male counterparts. There were no other gender differences we could find. What about the MCQ results? And here the picture is slightly different. Post-family medicine doctors answered around 44% correctly with the questions, whereas first-year PUST participants answered 42% correctly, and intern family medicine doctors 38%. Overall, we can say that the post-family medicine doctors who finalized the 2 years program had the highest number of best achievers. They were reaching up to 60% of correct answers, compared to PUST first years, less than 50%, and interns, less than 45%. Differences between the three samples, however, are minimal. And with post-family medicine doctors and first years being slightly better achievers than interns. And you can see that here again in the box plot, which is comparing actually both the OSCE as well as, or showing the OSCE results as well as the MCQ results. What are the conclusions and recommendations? And again, really in a nutshell, we've produced a over 100-page report, so there are a lot of recommendations, but this is just a summary. I think from the results, and particularly looking at the OSCE and knowing that the PUST has a very strong focus on clinical competencies, it shows a very significant and positive impact when we look at the education of family medicine doctors in Tajikistan. And drawing from that, we would really recommend that one should expand this program nationwide and actually making it an example for all specialty trainings in the country to have a duration of at least 2 years, ideally even longer, to adapt it to international standards. It also gives an excellent opportunity to systematically strengthen the theoretical as well as the practical knowledge, skills as well as competencies. And I'm not talking only about family medicine doctors, but also of the tutors supporting them. Overall, we see it's a successful approach to increase the delivery of high-quality primary healthcare services. This evaluation could not have been done with all of these people listed here. There were many, many people involved supporting the evaluation, and 2 of them are also here in the audience, Helen and Greta, sitting here in front. So thank you very much for that.